welcome to Local Doctors on Call. I'm Candace McAlia. We all know that eating a healthy diet can not only keep our weight down, but can also improve our overall well-being. And who hasn't heard that eating carrots can improve our vision, right? But does it really? And what about other foods rich in vitamin C or other nutrients? Nutrition can actually have a direct impact on your eyes and your eyesight, and that is our topic tonight. We have two great guests here to talk about nutrition and the eyes, Dr. Cathy McCabe of the Eye Associates and Dr. Susan Beck. Dr. Beck is a board-certified optometric physician now serving the residents of Sarasota at the Bee Ridge Vision Center. Dr. McCabe has been named as a laser vision top 100 surgeon for her vast experience and excellent outcomes in LASIK. She has also been named to the Premier Surgeon 250 list of the leading innovators in premium IOL cataract surgery, and she works at the Eye Associates. Welcome both of you to the show.
Thank you.
Thank you so much for being here. So we have a really interesting topic tonight, nutrition and eyes. So I guess the first question, Dr. McCabe, is for you. How does nutrition affect our eyesight?
Well, nutrition affects every part of our bodies, and particularly in a few different areas in our vision. It can affect the surface of the eye, the health of the eye in conditions like dry eye. It can affect macular health in conditions like macular degeneration and cataract formation, or just the natural aging processes that happen in the eye.
Okay, so that kind of leads me to the next question. Dr. Beck, for aging eyes then, would nutrition be more of a help for aging eyes, or is it really no matter what age you are, nutrition will help with your eyesight?
Well, whatever age you are, nutrition certainly will help. The younger you can have healthy diet, the longer you'll have a healthier eyesight and healthier other parts of your body. But especially for those who have or cataracts and macular degeneration and dry eye, there are nutrients that can help,
So sometimes they really help to decrease the rate that some of those happen
yes,
too.
that's what I'm looking for, decrease
Okay.
the rate. So something like dry eyes,
Right.
Flaxseed, and people have heard flaxseed and fish oil are good for supplementing your tears, and nutrition also plays a role in helping you get the nutrients you need for cataract and macular degeneration.
Wow, so really lots of different conditions nutrition can affect.
You know, you think about it, you think about cataracts really form when you're older, and macular
Right.
degeneration is an older condition. But for myself, my grandfather had wet macular degeneration, and so I'm too young, thankfully, right now to really have signs of macular degeneration, but I may have a genetic predisposition to it, and so knowing that information, I try to make sure that I'm eating a little bit healthier, some of the things I know are protective. And so even if you don't have one of those conditions, there are things you can do to try to decrease your risk of those things progressing. You know, everybody will develop cataracts one day. Mm-hmm. And it's not when you have a cataract that nutrition is going to really help.
Right.
It's in those years before your cataract develops that maybe you are taking better supplementation, you're eating a healthier diet, and it decreases that rate that the aging process happens in your eye.
Great. Well, I want to remind all of our viewers that our phone lines are open. So if you have a question for Dr. McCabe or Dr. Beck, give us a call and we'll answer your question live on the air. The number to call us is 361-4675. We're talking about nutrition and eyes, but the doctors will answer any eye-related question that you may have. So go ahead, don't be shy, give us a call. Our lines are open. So I know you mentioned cataracts and macular degeneration, but are there any other specific ailments that nutrition really specifically can help?
You know, it used to be we didn't really talk about nutrition too much with our patients, but I find myself really spending a lot of time talking about the specific things that certain nutritional supplements can help. And I know you probably do too with your dry eye patients. Are there some things specifically that you're recommending?
Yes, flaxseed oil and fish oil contain EFAs, essential fatty acids, which those coupled with maybe some artificial tears can really help alleviate the symptoms of dry eye, the burning, the visual fluctuations that you get. And it's people, I think, a lot of times want to know which is better, flaxseed oil or fish oils. And there are many differences between the two. And either one will give you benefits if you couple it with, like I said, artificial tears, but also with a healthy diet that includes vitamin E, vitamin C. Those are all nutrients that are going to help you with your overall health and with the state of your dry eyes.
And we were actually talking earlier before the show and about how really you can supplement these vitamins by eating right. You don't necessarily have to take a vitamin, right? You can actually just eat healthy.
Yeah, your body processes those vitamins more efficiently and with better absorption if you really eat them in your foods.
Right.
So, it's pretty simple. You don't have to really think a lot about it. It's really colorful vegetables, colorful fruits, fresh food rather than canned or cooked vegetables actually is better for you. So, one thing that I thought was kind of interesting to learn, as I, was taking care of my kids and trying to figure out how we're going to give them better nutrition, I used to always think you had to give them fresh vegetables in order to really maintain the nutritional content of your vegetables. But today, with modern processes for flash freezing vegetables, really vegetables that are frozen are as nutritious as fresh vegetables largely. So it's canned that you want to really stay away from. Yep, absolutely.
And eye supplements, they're just that. They're supplements. They supplement an already hopefully nutritious diet that you're having. It's not something you can have junk food all day and then pop a few eye vitamins and think that you're on your way to good ocular health.
Right.
Wouldn't it be nice if it was so easy?
That would be wonderful.
Donuts all day. Full of vitamins.
Exactly.
Doesn't work for me.
I know, unfortunately. Great. Well, we're talking about nutrition and eye health. So if you have a question for Dr. McCabe of the Eye Associates or Dr. Beck, please give us a call. Our number is 361-4675. So you mentioned earlier, Dr. McCabe, pretty much everyone is going to get a cataract one time in their life if they grow to be old enough. But can a good diet and nutrition prevent that, or?
It can't prevent you from ever getting a cataract, because a cataract is actually the natural aging process of the lens in the eye.
Okay.
So the lens in your eye is what a cataract is before it develops those opacities, and we call it a cataract. And it's made out of proteins, and those proteins over time become less and less water soluble and more opaque. And once they're opaque enough that it is interfering with your vision, we take it out. We can sort of delay that process of those proteins becoming opaque by really good nutrition. And there are some things that accelerate it. Poor nutrition, exposure to sunlight, and smoking in particular. And if we're talking about nutrition and health, I'd like to mention smoking because we don't think of it as a supplement, obviously, or anything, but boy, that affects every part of your body. And really, all of these disease processes we're talking about in the eye are because of oxidative stresses, stresses that cause damage in the tissues. And smoking is just the antithesis of nutrition. It accelerates that oxidative damage. So first thing, 1, 2, and 3, if you're a smoker, first 3 most important things are stop smoking, stop smoking, stop smoking.
Right.
Everything else is minor compared
I would
to that.
imagine smoking would affect dry eyes too, right?
Yeah, absolutely.
Well, and the key to good optimal health for your body and your eyes is to stop chronic inflammation. Chronic inflammation is what ages our body, what puts us on the path to develop cataracts, to develop macular degeneration. And there are nutrients that will have an anti-inflammatory effect on your eyes and your body that will delay that process. And especially something like macular degeneration, that's a breakdown in the back of your eye, your central part of where you see. You start to build up debris in the back of your eye because your cleanup system has kind of broken down, and debris is left there, and you're left with a blind spot in your vision. You may have heard of wet and dry, and some people get bleeding back there.
Right.
So there are nutrients, especially lutein and zeaxanthin, that they found that actually enhance your macula, the back of your eye, and make it a more sturdy barrier against damage from macular degeneration. And that can be found in red bell peppers. Kale has a lot of lutein in it, and spinach, and these are all really good nutrients that you could take to help more against macular degeneration.
Okay, it seems like kale is one of those things everyone's talking about nowadays being really good for you. So
Yeah, I used to think of kale as kind of like this bitter, kind
Yeah.
of tough green, but there are so many different ways of
Yeah.
preparing kale. It can be very tasty, actually, and
Yeah, and
I don't know if you've ever tried that dried kale chips and things like that.
I've made that, and
So good.
if you saute it, kale is actually better to get the lutein if you cook it because it breaks down the cell walls and it releases the lutein. So sautéing it or having it in a salad, you can get a whole day's supply of lutein with just a cup of kale.
Well, I believe we do have a caller on the line. Hi there, welcome to the show.
Hello?
Yep, go right ahead. What's your
Hi.
question?
I'm calling. I need a recommendation for a really good glaucoma specialist because I'm going to be needing a trabeculectomy.
Well done. That's not an easy word to say, and you did a wonderful job saying it too. So trabeculectomy, and yes, obviously I'm one of the physicians at the Eye Associates, and we do have a glaucoma specialist in our practice, Dr. Friedman, and you may have seen him at a time or two on the show, actually.
Yeah.
So I would recommend Dr. Friedman.
Great, thank you so much for your question. And if
I'm sorry, it's Friedman, Dr. Friedman. Yep.
And actually, on that note, why don't we go ahead and put up the phone number and the website for the Eye Associates. So in case you did want to give any of the doctors there a call or check them out online, you can go ahead and give them a call. And there's the number. It's 1-866-865-2020. Or you can check them out online at site4life.com, and that's site4life.com. And that's where you can reach Dr. Friedman or any of the other great doctors over at the Eye Associates. So thank you so much for your call. And our lines are open. If you have a question for either doctor, please give us a call at 361-4675.